Good afternoon, everyone. My name is Gustav Talving, and I'm the moderator of today's webinar. I'm also the executive director of EuroPris, and EuroPris is a member organization consisting of 40 prison jurisdictions across the whole Europe. We're also a professional organization, and the purpose of EuroPris is to share practices and knowledge to improve prison practice in Europe. And moreover, EuroPris is a large network of professionals and related organizations. And today we're very happy to co-organize this event with the EUDA, the European Union Drug Agency, which is now today represented by Linda Montanari. I will introduce her a bit more later. So the topic of drugs in prison is always on our agenda, I would say, and it relates to a lot of different aspects of the prison practice. So you have a security aspect, there is a health aspect, there is a rehabilitation aspect. So all the most important fields in corrections or in prisons are sort of, say, involved in the drug issue. So today we will focus specifically on this and with a focus on trends, technology, and rehabilitation from mainly a security perspective. But as I said in the beginning, these are all involved, these areas in the issue of drugs in prison. So I think this is a very important topic to cover for us, among other topics, of course. But today we will focus solely on the issue of drugs. A few housekeeping things to mention before we start. You can ask questions during and after the presentations, and you do that by submitting your question in the Q&A. So that's the function where you find at the bottom of your screen where you can submit the question. And the questions will be monitored by my colleague Aune, who's also responsible for let's say, highlighting questions of relevance for the discussion. The webinar will be recorded, so you can share it with your colleagues afterwards if you want to recommend it or just revisit the content. And one of the presentation, the first presentation, will be shared as well as a PDF after the event. And for the Q&A, I would like to ask you to rename yourself. So you have your name, full name, and the country you're calling in from for us to know who's asking the question. That will be very helpful. And at the end of the event at 4 o'clock, we will have a short evaluation poll for you to respond to before you leave. So we really need your input and feedback to improve our operations. So that will be very kind of you to respond to these questions. And back again then to the Menti, Aune, if you can share your screen again. Thank you. So as you can see, there are a wide range of countries participating, and we can see also participation not only from Europe, but also from Northern Africa and other parts of the world. So we're very happy to have you all in this session. And this only shows the, let's say, the relevance of the topic, I think, as a general one for prison practice across the globe, actually. So thanks for responding. We will continue to the second question. So what kind of organizations are you representing? We have a couple of different alternatives that you can respond with. So we get some kind of distribution here. if you haven't connected yet, you can use the QR code at the bottom left or the code on top of the page. So as we can see, prison practitioners are highly present, but we're also very happy to see that persons connecting from inspection bodies, inspecting prisons, from academia, NGOs, some from private sector as well. So you're all very welcome. Next slide, please. So what is your professional title? Just to see what kind of skill sets and experience we have in the room, so to say. Wardens, prison officers, very happy to see that. Security specialists, senior specialists, directors, governors, students, heads of departments, data analysts. Amazing, amazing. So it's a broad range of, let's say, roles that are joining today, which also makes us happy, especially to see that many prison professionals joining, of course. So again, thank you for submitting. We will now continue with the content of the webinar. So I'm today very happy to present to you or introduce four experts in the field. We have two speakers, Linda Montanari. She's the principal scientist and coordinator of the area of prison and drugs at the EUDA, the European Union Drug Agency, and Sarah van Malderen, who works as a national coordinator of prison drug policy, and she's the project lead for drugs and conflict and aggression policy in Belgium at the Belgian Department of Justice and the Prison Service. And for the panel, we have invited one of our experts from our expert group on prison security, Mr. Angel Vicente Lopez Muriel. And he's originally from Spain, working in the General Secretary for the penitentiary institutions in Spain. And last but not least, we have also with us today Thomas Hanikangas from Finland, working as a senior security manager in the Prison and Probation Service in Finland. So we are very happy to have this distinguished speakers and panelists with us today. And the structure of the webinar will be like this. We will start with two presentations, and after the presentation of Linda, you will have the opportunity to ask a few questions specifically related to her presentation. And then we will move on with Sarah's presentation. And the same thing there, if there are any clarifications needed on the presentation, we can bring this up for clarification. And last, we will move into the panel discussion where we can address more complex issues and share, let's say, questions between the panelists and the audience. So hopefully this will work out within 2 hours. That's the ambition, at least. Again, I wish you very welcome to this webinar. And I would now like to give the floor to our first speaker, Linda Montanari. Thank you.
Thank you, Gustav, and thank you to EuroPris for inviting us to this webinar, which of course is very important for us because drugs and prison is one of the area where we are working as a European Union drug agency. I share my screen. Can you see it in full screen? Okay, so I will present you some of the latest trends in the drug use and drug-related problems in Europe in general, in the community as an introduction, and then I will go more in depth in what concern the relation between prison and drugs. So first of all, as Gustav was saying before, so we are doing this together, and our agency, which is now called since July this year, European Union Drugs Agency, is a decentralized agency of the European Commission. Before has a mandate mainly to collect data and monitoring the drug situation and responses in the European countries. And since July, our mandate was enlarged. So now we have the objective to support the European member states, providing services in anticipating new and future challenges in the drug field, alerting on emerging risks, assessing the needs, and also assisting stakeholders by providing also training and information. We work with the network of national drug focal point, which are institutions nominated by the European government of the 27 European member states, and we work also with Norway and Turkey. Here's some information, as I say, from the latest European Drug Report 2024, which was published in June this year and is based on the data 2022. There is a 2 years gap between when we collected the situation and when we disseminate the data. The main message is that today drug-related issues appear almost everywhere in the society, and almost everything can be used or can be a psychoactive substance, and everyone can be affected, whether directly or indirectly. Of course, then there are differences between setting, between population, and of course the prison population deserve a specific attention regarding the drug phenomenon. So first of all, in terms of main trends, again, in the community, we have seen in terms of supply-related indicators that the availability of drugs remain high across nearly all substances with the broader range of drugs. Also, there are more substances that are highly potent and have high purity and are appearing in new form or mixtures and combination. And there is a growing diversity of drug forms, so the drugs can be taken as via orally or vaping or injecting, snorted, sniffed. But this means that there are also greater risk for the people who use drugs to experience drug problem, because also they are often mixing these substances and there is limited knowledge by the user, but also the professional on what is included in these substances. Another big issue that was emerging, probably become more explicit with the COVID pandemic, is the mental health problems, which we know is higher in the population that are regularly or intensively using drugs, where the mental health disorder are always appearing either as a risk factor or as a consequence, or the two sides among the people using drugs. And finally, the polydrug use is a very important issue, and we will work more in the future on the polydrug use, because we know that most people who use drugs, especially those using regularly, they are not using just one substance, but they use different types of substances at the same time or sequentially, and often combining licit and illicit substances, which then involve different type and more serious type of risk. Then just looking at 3 types of drugs. Of course, there are many more where we can talk about, but cannabis remains this illicit substance that is the most used in the population, with 15% of the young adults that have used cannabis at least once in last year. In 2022, 43% of all people that are entering treatment, drug treatment, were primary users of cannabis, or corresponding to 92,000 clients. And we know that cannabis is not exempt from harms, both psychological and physical harms. So they can cause chronic respiratory symptoms, so dependence, psychotic symptoms, and I think very importantly, among the young adolescents, regular use of cannabis is associated with poorer educational achievement. And I think for this target audience, is important to know that also the risk of involvement in criminal justice system for those using more intensively is high. Cocaine is the most used stimulants, with the prevalence of 2.5% among young adults in the last year, and around 30% of all treatment demand caused by main use of cocaine. Also, cocaine, we know, is related to harms that both, again, psychological or mental health harms and physical harms, so like psychosis, cardiovascular problems, cocaine and alcohol use. And the combination of these two substances created new substances, which is cocaethylene, which is causing damage in the liver, but also seizures, is at the origin of several physical harms. Cocaine was also involved in around 1,000 deaths with opioids. Then heroin. Heroin is used by less than 1%, opioid, let's say, of the population, 860,000 people, and represent only 12% of the heroin the treatment demands. But it's very important to consider because it is at the basis, at the origin of the drug-related deaths, of the most of the overdose deaths include opioids, usually with other substances. In 2022, there were 6,392 drug-related deaths involving opioids. And we know that in this case, opioid agonist treatment is a protective factor. Then the challenging for the futures that we have to be alert and anticipate, I just would like to highlight three. First of all, in this population of opioid user, which is not the biggest population of drug user, but is seriously affected by the drug use, there is also an aging population. That means that then they combine the harms related to the use of opioids with all the problems related to aging. Then on your right, you see also the number of new psychoactive substances that were reported to the early warning system. There were almost 1,000 since the start of the early warning system. 26 were detected this year, and this is something that we have to be alert to, because there are different types of new substances, from synthetic cannabinoids, synthetic catechins, new benzodiazepines, and new opioids. And this, I come to the graph in the middle, where you can see that there are now 12 countries that have more than 25% of clients entering treatment for opioids that are not entering treatment for heroin, but for other opioids. And it is something that I think that can link also well to prison, because we know that were some emergence related to the use of new synthetic opioids. We'll talk later in prison in the European countries. So now this is like the main information regarding drug use in the community, but you know that the prison population is not disconnected from is part of the general population, is connected with the community. So every trend in the community can be replicated also in prison, also in the different way. When we talk about drugs and prison, I think an important distinction, clarification is to consider who are the group, the different groups that are connected to, in some way, to the drug issue. So first of all, as you see in the map in the left, is reported the percentage of people that are in prison for drug law offenses. These are the data based on the Council of Europe statistics, and we know that on average in Europe, 18% are in prison for drug use or drug trafficking. We are now working with the Council of Europe to distinguish between these two things. But it's important to consider that not all people in prison for drug trafficking are also using drugs. But then we have to add to this the group of people who are in prison for offenses committed to support the drug use or related to drug use. So the acquisitive crime, the drug-related violence that lead to imprisonment or others. And then finally, there are people who are in prison for other type of crime and have problems. They are using drugs, or some of them may also have problems related to drug use, because we know that the prison population is a particularly vulnerable population from different point of view, including social vulnerability. So I think this is an important message that is not just the drug law offenses that should be considered when we talk about drug and prison, but really the population in itself. Here are the latest data that are available on the lifetime prevalence of illicit drugs before imprisonment of the prison population compared to the general population. In the graph, in the histogram on the left, you have the blue line is reported the prevalence in the prison population, the green line is the general population, and the dot line is the excess. As you can see, in all countries, despite differences, there is an excess of drug use in the people, in the prison population, and this is referring before entering prison, compared to the general population. And if you look at the table on the right, this excess is very high when we look at, for instance, cocaine, and even higher for heroin. So where we have less than 1% in the general population and 36% who experience, this is the maximum value, have tried heroin in their life. Then drug use inside prison. We know that many people stop using drugs when they enter prison, but other, because it's illegal behavior, it's more difficult to get drugs inside prison, but others reduce the drug use, or other continue to use drugs, other change the drug use patterns. We know, for instance, that in order to make drug more efficient, there are more people that are injecting drugs. And this is the graph reported on the right. On 8 countries reporting data on injecting before and inside prison, where you can see that in most countries, of course, inside prison, the prevalence is lower, but still it exists. And drug injection inside prison is a specific risk, because the material we know for injection is scarce, so the people tend to share or to produce their own material with high health risk. Some people also start using drugs inside prison, with 1/3 of those using inside prison from one research reported to start using drug. Of course, there is a lot of variability in the data, as you can see, and this is related to several factors that are methodological, but also others. How the drugs enter into prison, you know better than me this thing. So the main route are external visit, people movement, new technology, throw over the walls, spray it on paper now with the new drugs. And their supply reduction measures are regular control, detection dogs, scanning technology, and other new technology that are now found for the new drugs, drug testing, photocopying letters. In our publication report published in 2022, we look in particular at drug testing, and we found that out of the 30 countries at the time included in the report, 3 didn't do any drug testing in prison, 24 did drug testing in prison. We asked also what was the purpose of the drug testing. So for 14, they were using drug testing for both security purpose and treatment purposes. In 9 countries, only for security purposes, and in 3 countries, only for treatment purposes. I think one question that is probably more for the audience and for the expert from your area is how how expensive it is, and however, what is the cost effectiveness of the drug testing, because there are not many, to my knowledge, at least to our knowledge, many studies looking at the effectiveness, not the validity of the test itself, but the effectiveness regarding the different purposes. One thing that you probably are aware is the use of new psychoactive substances in prison. We published a report. You can find everything in our website on use of NPS in prison, and we found in 2018 that 22 countries reported the use of some use of new psychoactive substances in prison. Mainly at the time it was synthetic cannabinoids, but also synthetic catechins. And lately, you are surely aware, there were this emergence of use of new synthetic opioids, particularly nitazene, which is a very strong opioid in some prison. And I don't know if there are Irish colleagues here, but they managed to control the situation by informing the staff and the people in prison. The reason for using these substances is that they are easily accessible and most of them not detectable, or initially at least they were not detectable, cheaper, often they are more potent, but often they involve risk that nor the staff nor the people know, and should be addressed. One thing that I would like to just highlight is a small population, the women in prison. They represent only 6% in Europe, but their relation with the drug issue is very relevant, because many of them are in prison for drug-related offenses, both drug law offenses and acquisitive crime. And if very few go to prison, the few that go to prison, they have a very complex profile and life trajectory, with gender-based violence being one of the key factors in their life that probably determine also many of their trajectories. And these, I think, should raise question for the prison authorities and people working in prison, but also before in the prevention in the community. We know also that the population in prison have a high burden of disease. I would like just to focus on two that are related to the drug issues. So the infectious diseases, and you have the prevalence of HIV and HCV among people who inject drugs and are in prison, and the percentages are much higher than those reported in the population, and psychiatric comorbidity. As you can see, the prevalence is, even if the range of studies is wide and there is no still a comparable methodology for collecting this data, we see that it's up to 90% of the prison population that may have some kind of comorbidity, so mental health disorder combined with substance use disorder, compared to the general population, it is up to 51%. And this, it means that there is a high risk of suicide, self-harm, and reoffending. Finally, mortality, we should look at from the drug also point of view at the mortality inside prison, where we know that many of the suicide is the leading cause of death, so it's linked to comorbidity and all these things, and of course the prison context, but also there is a huge percentage of violent deaths inside prison. This is based on a French research, and of these deaths, 1 in 10 is due to intentional and accidental drug overdose or intoxication. So again, so the drug issue is coming back here. And another issue that you probably all know is the mortality after prison release for those who were using drugs. Is the risk of dying for an overdose is extremely high after prison release, especially in the first period after prison release, due to the reduced tolerance. So what is done? What is the evidence? In this report, we have a chapter dedicated to the evidence. I won't enter, of course, in this detail, but we know that evidence is scarce. But one has to wonder, if we need specific evidence, or indeed we need some study on the acceptability of some intervention inside prison. Some are implemented, some are not implemented, but the level of implementation is still scarce. Here is a graph reporting a number of countries where officially the different type of drug-related intervention are reported. And as you can see, we go from intervention that are implemented officially, at least in all European countries with which we work, like the infectious disease testing or opioid agonist treatment continuation from the community that is available in all countries except in Slovakia still. And there are interventions that are available in very few countries, like needle and syringe program, only 3 countries, in Spain, Luxembourg, nationwide, and then in 1 prison in Germany, or naloxone distribution. But as I say, if this is the official availability, this doesn't mean that are covered and are introduced at the right time, and there is a big delay between the introduction in the community and in prison. The yellow line is the introduction of opioid substitution treatment in the community, and the green line in prison. As you can see, in most countries, there is a delay of 10 years or more. And the coverage, first of all, this is an example of one intervention, which is HIV and HCV testing in prison. First of all, we have very little information. And second, the coverage is very low in most countries. Full is only in few countries, means more than 90%. So to finish up, what we would like to do is to develop training, because I think that most is passing through the acceptability, as I say, of some intervention, rehabilitative intervention, the sharing of information. We have prepared some material on based mirroring our report of the prison insights. We try to have this, we didn't pilot yet. We hope to be able to collaborate also with EuroPris on this. We have prepared module with the slide, annotated slide, told through exercise, very short, so flexible and possible to be used by professionals that we know they are very busy and a very complicated setting for conducting training. So some just key issues to highlight. So the people who use drugs are overrepresented in prison. They have high burden of physical and mental health disorder and multiple vulnerabilities. Drug use in prison exists, is reported, but of course is always this issue when you intervene to find the balance between care and control. A challenges will be the use of NPS inside prison. And from the point of view of the intervention, is important to increase the coverage of intervention, the skills and acceptability of the intervention, and to consider that the prison health doesn't mean just health in prison, but means health, public health in all the community, because these are people that we know have are dynamic population moving in and out of prison. So thank you very much. I would like just, I don't know if any of you will come next week. We have the Lisbon Addiction Conference, where there are several sessions on drugs in prison, and there will be a specific conference on organized by Health Without Barriers on prison health the day before the conference. So thank you very much.
Thank you very, very much, Linda, for this exquisite presentation. It was very dense in information, and I think it sort of shows the range of what you do at EUDA as well. So I think there is a lot more to investigate and explore on your website. So that's definitely a tip for those who haven't visited the EUDA website. Yet you can find the report and the other evidence material that Linda is referring to. So we have now some time to open the floor for questions directly relating to Linda's presentation. And while you submit those in the Q&A, I can take the time to just mention the training aspect that you brought to our attention, and it's a very good timing in that sense, because EuroPris and EPTA, the European Penitentiary Training Academies, are now merging into one organization. And with EPTA as part of EuroPris, we have a lot more, let's say, capacity, and also doing cross-European trainings also on this topic. So that's an interesting area to explore and invite practitioners for such trainings. I have a question also about the map you showed on new psychoactive substances. So I don't know if you can bring the presentation up again, and I can ask you the question when we see the slide. Maybe that's easier.
Yes.
Thank you.
Yes. This
Yeah.
one.
So when you look at the, let's say, the use, I don't know how are these 2022 data.
Yeah, sorry. This was published in 2018, so
18.
it's based on data 2017-18.
So the field has moved on slightly, I
Yes.
suppose, yeah, based on this. But anyway, I think this map is quite interesting, because what triggered my question was actually the concentration of countries where MPS are more common. And if there are, let's say, trade routes that explain this concentration, or if it's more resistance from other, let's say, drug cultures or similar in the other countries, or how would you explain or elaborate a little bit on this result?
It's not, I don't think there is a straightforward answers, but the first thing is that there is usually like a mirroring on what happens in the community, first of all. So, because as I say, the prison population is not separated from the community, even if there are different type of patterns of drug use. MPS are mainly also produced in the countries, and of course, I think there are probably similar routes, as you say, of production of these substances. But I think it's something that we should better analyze and better look, because also, as you say, the issue is evolving all the time, and now probably the situation, for instance, with the synthetic opioids has changed, and we will expect that it will change again more. But for sure, it has to do with the community and the production side. I don't know if I replied to your question.
Yes, for sure. I mean, that makes full sense. I understand that it's not one explanation, but I think this is a very important, let's say, context also for prison services to know sort of where these trends come from, and also how they are reflected in the prison. So thank you for elaborating. We had also another clarifying question regarding, so if you stay on the presentation, it
Yes.
was about from Kevin Krönström in Estonia. He's asking whether there are data and statistics on drug overdoses and deaths in Europe, and I suppose there is.
Yes. This is what I was presenting at the beginning. Maybe I can go back.
Yes.
So where because it is, yes. So we have one epidemiological indicator that is looking at the drug-related deaths. And in 2022, there were 6,392 deaths, which correspond to 22.2 million per adult population. The highest drug-related deaths rate are reported in the northern countries, and I think Estonia probably is. I have to check, but is one of the countries, because it's usually one of the countries where there is traditionally, since long time, is not new, but there is large use of fentanyl among the problematic drug users, illicit produced fentanyl. We didn't detect any drug death inside prison this year. There were these indication of these 2 deaths in Ireland. They're probably Irish colleagues connected, but what I was told is there was no toxicological confirmation that these deaths were related to ritazine, but they were drug-related deaths. And we have, together with the drug-related deaths, also the other indicator of mortality on people using drug, which is more complicated because the drug-related death is based really on toxicological analysis.
I see. But we can find more information about this on your
Yes.
website as well. Yes, thank
Yeah,
you.
in the European Drug Report, there is a section on this. There is also quantitative data where you can find all the data country by country in our statistical bulletin. And there is one report on health and social responses guide dedicated to harms and death.
Thank you. So we have one question on drones, and I will save that for the panel. But a more practical question about the conference you mentioned. Susanne McGregor is asking about, is it possible to register for the day before the conference focused on prison health already now?
Yeah, is the 21st, or that means Monday starting. I wanted to show. So this is the 21st and 22nd of October, and you can register. I think you have to look at the website. I can send to, I can put also here in the chat the website for registering. So it's divided in 2 parts. The first day, there will be half day dedicated to the conclusive meeting of a European project on vaccination in prison, and the second day that I'm coordinating with the chair of the Health Without Barrier on women, drugs in prison, and the third one on prison health in general. But
Thank you so much.
After this,
Thank
I
you.
will put in the chat.
We will share the link to the conference if we don't put it in the chat. But thank you so much for your elaborations, Linda. I think can move on now to the second presentation. So if we stop sharing, I would then like to introduce Miss Sarah van Malderen from Belgium. And I caught my eye in the map that Linda showed over Europe, and the proportion of persons in prison for drug law offenses in Belgium was around 50%. So that was extremely high, I would say, and it would be interesting to hear more about that. But that is not your main focus of your presentation, Sarah. It's on the results of the Drug Detect project that you are running with a couple of other countries. And drug detection is, of course, one of the pillars of, say, drug security in prison, but it also, as Linda mentioned, sometimes question whether how effective it is. So it will be very interesting to hear your results and your achievements so far in this project. So with no more ado, please, Sarah.
Thank you, Gustav. I'm looking to on that will share my presentation. Yes. Yes, thank you. So today the objective is to elaborate on the innovation in Belgium concerning prison drug detection. Next slide, please. Yes, it's on innovation in drug detection, but I can reassure you that I will not go into technology details and technical information, but I will highlight the potential of technology, not only in terms of security, but also in terms of health and rehabilitation. But it's really a potential that we can use to go further with technology than only focus on security. So that will be also a main focus of this presentation. Next slide, please. Like Gustav was already mentioning, we are running the innovation program in Belgium, but we do it together with other countries. And therefore, also today, I can share our Belgian experiences, but it has lessons also beyond Belgium and even globally. That's also why I'm really excited to see at the beginning of the webinar the presentation of several jurisdictions globally, prison officers, directors, diverse profile and staff here in the webinar that we can maybe discuss, but also afterwards maybe talk more into detail in terms of further collaboration, because this is Belgium together with other 4 countries, but we also have to see beyond the borders. As we know, it is a global challenge, the drug phenomenon in its globality, but also in prisons. Next slide. But first, when I have to go into detail, I have to take you where it all began. Next slide, please. And that means that it started in Europe with 4 countries, the Netherlands, Belgium, Spain, and Greece. We were collaborating together and we are confronting the same needs and the same issues in prison. So really these 4 countries representing the prison administration. What do we encounter? It will not surprise you that existing methods of drug detection are not sufficient. Maybe some of you also have sniffer dogs to use to detect drugs, but you know that sniffer dogs are limited in terms of the amount of drugs that they can detect. So that's an observation. Sniffer dogs are limited in terms of type and amount of drugs that they can detect. Also sniffer dogs and the also drug testing. When I talk about, for example, urine testing, it is not focused on NPS, it is not focused on new psychoactive substances. As we know, there is a rapid evolving drug market, and existing methods do not follow the rapidity of the evolving drug markets. So for us, for Belgium, it was a really special focus to concentrate on the new psychoactive substances and to go beyond the classical products, meaning cocaine, heroin, and cannabis. So a real focus on new psychoactive substances, synthetic cannabinoids, synthetic opioids, synthetic catechinones, like already Linda also highlighted. So that is really our main focus. Also next to that, we know that new psychoactive substances, they are also highlighted by Linda, way cheaper to produce, also really easy to smuggle into prison. For example, paper, incoming mail that is impregnated with synthetic cannabinoids. We cannot see it with the eye, we cannot smell it, we cannot, so we are really limited in terms of detection. So that is a real challenge, also underlined not only by the EUDA, but also by Europol, the WHO, UNEDC. So it's really a global concern. That is really not only about the types of NPS, new psychoactive substances, but also the ways of smuggling into prison. So also the drug market and the organized crime in prison is also adapting in that way that they can also smuggle these substances into prison. And that is a really advantage of new psychoactive substances. These products are more potent. You already heard from Linda. So the risk of overdose, but not only the risk of death, but also the risk of more disturbing behavior on a daily basis in prison. It's really disturbing, also for staff, for inmates and for staff, meaning also an increasing number of violent acts in prison over the several years that are also related with a higher consumption of new psychoactive substances, because these substances are more potent, more risks are included, more violence, and so on. We also see to clarify or to illustrate that 15 years ago, we did a self-report in the Belgian prisons on victimization among prisoners concerning the drug environment and drug-related topic in prison. And that time, 1 in 10 of the prisoners said, yes, I was already the victim of drug-related violence. Violence in three definitions: physical violence, verbal violence, and sexual violence. So 1 in 10. Now the figures show us 1 in 2. So it's really amazing and really disturbing trends. So when we talk about drugs, health, we are all on the same line, but you also have to take into account the violent acts and the violent behavior, and also the suppression of other prisoners to smuggle drugs into the prison, the organized crime. It is really a big, complex crime nexus when we are talking about drugs in prison, when we are talking about drug detection in prison. And also, why are the prisons as a setting so important? Because effectively we have an overrepresentation of problematic users in prison, and that makes us so special in a bad way. But when we compare it with society, that's also a reason why we have to have a particular focus concerning drug detection and drug use in our prison system. It is already a very vulnerable population, also in terms of rehabilitation afterwards. So it is really key that we know what is happening in our prisons in terms of drug use, but also in terms of drug smuggling, and which measures that we can take to not only keep staff safe, but really also keep the prisoners safe. But I will go into detail later on. Next slide, please. With these 4 countries together, so we shared same needs, same concerns, and we had luckily the opportunity to organize these 4 countries in one consortium, the Drug Detect Consortium. And we were lucky that we were financed by the European Union under a program focused on the innovation of procurement. So a procurement, it means purchasing a device at a certain moment. So the drug detect device, the innovation on drug detection that I will elaborate on, is also supported by a European program. What was for us the main concern? That was already clear. We want to detect a large number of drugs that is available every day, every hour. We are a full continuing system at the prison environments. No human intervention needed, no animal intervention needed. So that was for us really the focus. Next slide, please. With that on focus, we scanned the international market. We really scanned which devices, which technology is already in place, but really internationally. So not just European, but internationally. Then we were able to engage more than 32 enterprises. So we really included the industry. It is really a good example of a collaboration between government departments and the industry, because we need the industry in this case in terms of research and development of technology that are apps for us, that are useful for us as a prison administration. Doing so, we could identify 2 different devices, if you would say, 2 different lots to purchase, 2 different devices. The first is focused on the detection and identification of traces of drugs. The second was focused on detecting, not identifying, but detecting drugs on the body. Belgium and also Greece, like you see, we chose for the detection and identification of traces of drugs. Why? Next slide. Because, like I said, we have a special focus on new psychoactive substances. You cannot see it, you cannot smell it. So for us, it was really important that we had a device that could detect drugs visible by the eye, but also not visible by the naked eye. That's why we are focused also on traces. Maybe an example from practice. In cells, you do a cell control, you see a jar with flour, sugar, I don't know. This device is able to directly identify whether it's an illegal product is or no. So it is really a good investment on time also, because otherwise if you send it to the police, they have to check it. Oh, excuse me, ma'am, it's just floor. Okay, waste of time. But so that is an example of visible by the naked eye, but we also want to see whether there were traces of drug use in a particular cell, in a particular workhouse, in a particular visiting room. Why? To really map, and that is key for us, to map the drug phenomenon in our prison. Next to this, we really want that specifics of the device were also adapted to our prison context. You can imagine people who are working in prison, if you have to carry a big box, because the most obvious or existing devices are big printer-like boxes that you have to carry on. It's not easy to move on. So that was a really priority for us, for the prison administration, that it was handheld, small, mobile. It's really like a purse with a strap that you really can put on your shoulder and walk around in prison. Also, the little window that you can see the alarm of fentanyl as an illustration. When a prison officer is using the device, it is like a swab. I will show it directly. Really focused the fentanyl example, then the prison officer, when he or she scrolls down, he can see an explanation of the product directly. Because if somebody sees, oh my God, alarm fentanyl, he or she goes into crisis. Okay, just keep calm, scroll down with which product we are confronted with. So really dummy proof, easily explained the dangers or the limited dangers of a certain product. The device is focused on high pressure mass spectrometry, but I have made I have said that I will not bore you with technical details, but it's important to know that we can detect nanograms of drugs. That is really specific for this device. Next slide, please. I also look to the time, the phase we are in now, because it's a project, different phases, but now to make a long story short, you are in the innovation validation. It means that we are testing the device in our prison. We see, does it work, does it don't work, but I can assure you that it works. But every month we are also in dialogue with the industry who is still adapting the device for us. But I will come into details later on. Next slide. Next slides. The next slides, maybe I had a video fragment. We had a video fragment, but I think that is maybe on. It's another version of a presentation, but it's not that bad. I had a video presentation foreseen that you could see the device in operation, up and running, but no problem. I will explain it orally. So we saw the picture of the device. It's really small. And it works with swabs. Maybe if you take an airplane, when you go to the airport, sometimes they take swabs of your luggage by a little swab to test on explosives. It's actually the same modus operandi. So you use little papers where you can swab surfaces, also hands, but also materials of prisoners, but also as surfaces in the working house. When people are coming in, you can swab these surfaces to look for traces of drugs. Concerning the implementation of this innovation in Belgian prisons, and this is really key because we can use it solely as a security measure. It's clear, identify drugs, and then, for example, disciplinary sanctions, but then we are really focusing on catching the user. That is for us not the main concern. These are adverse effects, not only adverse effects, it is logic that you will have these consequences, but we want to do more than that. We really want to use it as a policy tool. Why? To map the drug phenomenon in Belgium. Also, Linda, in our presentation, she showed us a slide of new psychoactive substances in prison, sometimes not reported or low reported. Now, this device will give us objective data of products, new psychoactive substances that we will reveal in our prisons. Why do we want to use it as a policy tool, or how to adapt our health policy, not only our security policy, but also our health policy. For example, when a really dangerous new psychoactive substance is emerging in one prison, we can alert the medical staff, we can alert the medical service, so that we are one step ahead. We can also alert prisoners in terms of early warning system, for the people who are familiar with the early warning system. So we really want to use it as a mapping, that we know what is emerging in our prisons, but really also to adapt our policy. Next slide, please. This is something really important I want to share with you, because it is really relevant for the topic of this webinar, because we are talking about security, but we are also talking about a good balance between care and control. We want that the two worlds, security and health, that they collide in a positive way. And when we install innovation like this, context is key. The context determines the effect of technology, as it has the ability to make good things better, but also to make bad things worse. And what do I mean with that is just a moment. Yes. Is that prisons or highly secured environments. That is clear. And when we are putting into practice a device like this, we are highly focused on security. Who is using, where they are using, how the drugs are coming in. But we have to be alert that we also use the advantage of the mapping, that we also not only focusing on disciplinary sanctions and catching the user, but that we also focusing on the early warning system, like I already explained, and the collaboration with the medical service. That is a real potential of this innovation in Belgian prisons. So this is really, I think, also for colleagues abroad, if you install such a technology, you can really step into the pitfall of becoming more focused on security, because by history, prison environments are really repressive, and a device like this can be even more repressive. We also know that cultural change in a lot of prisons over the world, that the cultural change is occurring also in Belgium. But we have to be aware of the fact that there also can be adverse effects of using technology focused on drug detection in prison. So that's why I really have to include it, this sentence that is also used in redesigning enterprises and organizational change. Next slide, please. Now I will go into detail concerning the experiences and the challenges. Next slide. Yes, it is important to know that the device can detect more than 160 products. So for us, it is really a huge number. So more than 160 products, also cutting agents included. And the device can detect in one sample even more than one product. So this graph shows that the device is able to detect more than one product in one sample. For example, we can detect samples where cocaine is mixed with paracetamol, or where cocaine is mixed with other products. Maybe the next slide will be more clear. Next slide, please. Yes, here we can see that also MDMA, but also cocaine. Linda also highlighted the use of cannabis, cocaine, and heroin. You see that cocaine, that we often detect cocaine, but also a group of the NPS, the new psychoactive substances, that are so important for us. You can see below the abbreviations of the products summed up, or are synthetic catenones. So this is for us really new, because first this is a really new observation to discover the synthetic catenones, also synthetic cannabinoids that we had expected, and synthetic opioids. But for us, the synthetic catenones are really new. And also often the mixture with ethylone, what is also a really disturbing trend. So for us, before we only had an overview of the classical products. So for us, this is really an eye-opener also, and a confirmation of the concerns that also practitioners in the field, but also European bodies and agencies underlined. This is based on 7 prisons. This I have to explain further. This data is based on 7 prisons, 275, 57 tests included. So this data is really the start. So this is really the start of our data. We also have a data management plan, but I'm not going to bore you with that. But just to take into account that we just started this year by using the device, one device, and in several months we will have 10 devices, meaning that we can use these 10 devices for more than 35 of our Belgian prisons. And then we will have a big data mapping that will be possible. But this gives already an idea of the experiences so far. Next slide. This is the last slide. A lot of information on these slides, but I will try to keep it brief. We have the library. The library, for us, these are the 160 products. Like I said, the device is able to identify 160 products. So a library is included. If a product is not included in the library, if a product is not included in the device, we cannot detect it. So to be able that innovation stays innovation, we are working together with National Forensic Institutes, with CNSANO, briefly the focal points, like the EUDA and EuroPris, and several colleagues are familiar with. In every country we have a focal point. The national health institutions that are in collaboration with the system, meaning that we have the 160 products, but we want to include even more because we have a rapid evolving drug market. Every week new substances arise. We also have the ambition to include these new emerging products, because you have the 160, but we have to be ahead of the rapid evolving markets. So that is why that is for us key. When we detect a product in prison and when the device says no target detected, then we know, oh, maybe we have a new psychoactive substances detected for the first time in prison. That is why we are collaborating with a lab to confirm or not confirm. But also the other way around, trends, products that are emerging in society, that are on a list in the National Institute, that they also include these products in the library of the device. So there is a continuously collaboration also with the industry. When we propose to the industry of this device, we want to include this and this product, it is able to do so. And in that way, we can be ahead of the evolving drug market, maybe not ahead, that is too ambitious, but not really behind. And then the innovation stays innovation. So the library and the enlargement of the library is really key, but also partnership with the other partners of the criminal justice system is key. For example, in Belgium, there is an exchange between the police and between the prison administration in terms of modus operandi, which kind of smuggling routes do we observe, but also which kind of trends do the police observe in society. So there's really a collaboration between the several partners in the criminal justice system, the health department, like I already said. And also a strategy. That is also really important to have a strategy so that you not fall into the trap of merely security, but that you can really use the data, the trends to also alert staff, early warning system to also alert prisoners, and that there is a good balance between drug detection and really health and the rehabilitation of offenders, because they are more vulnerable to consume the more severe drugs. Next slide, and that will be really the last one. Yeah, so this is really an invitation actually to you, because this device or this project could see the light because it is embedded in a project, but also after this year, the collaboration doesn't stop, and we stay collecting data, that's for sure, but we stay also enlarge our library, and we also want to reach our hands to other colleagues in the field to exchange on trends, to exchange on substances or modus operandi that you are observing in your fields, to discuss and to really be involved together, that we really can map what is going on in our prisons in terms of the drug phenomenon. Thank you. I see that my time is up, so
Thank you so much, Sarah, and thank you for being mindful of the time. This leaves us room for plenty of discussion. Thanks again for this very dense presentation. It's a fascinating project you're conducting, and it reminds me of a project similar to this, which I was involved in Sweden, but that was long ago now. But that was also technology to detect drug use through exhalation. So there is a lot of technologies over the years that has been tried in prisons, but there is definitely no silver bullet for solving this problem. So you have to find not only the technology, but also how to use it, as you're mentioning. And I thought your reflection on using this data that you're actually collecting in so many different ways is very inspiring, I must say, for policy development, both on the European and national level, but also on the prison level, and take health measures and not only use it as a, let's say, security or disciplinary tool. So I think that's very inspiring. So many questions coming in. I will take a few ones which are directly relating to your presentation, Sarah. And one is relating to the cost benefit analysis of implementing such a tool compared to other measures that might be cheaper and more easy to implement. For example, fences, an additional perimeter, better windows, or other measures. And that is, of course, a relevant question for any technology that you may implement. Are there other methods which are more, let's say, basic, but actually more effective? So that would be interesting to hear your reflections on that.
I really think in terms of cost benefit. Audio zone, yes?
Yes.
Yeah, in terms of cost effectiveness, yes, you can have fences, yes, you can have perimeter controls. Also in Belgium, we are invested in drones, because there is also a real problem of drugs that's thrown over the wall or delivered by drones. But like you said, we cannot focus merely on one measure. If we focus merely on one measure, also the drug market and organized crime is really inventive. So if we're really going to focus, for example, only on securing the perimeter and fences, then there will be other holes in the system. And that is really if we want to really go into the challenge, we have to focus on several points. So yes, fences and perimeter, but for me, as somebody, I also was a prison director, for me, fences and perimeter security is more obvious. So for me, the device of the really drug detection is really complementary and really an eye-opener in terms of it is more than just preventing coming in, because there will always coming in, drugs will always coming in, but then we really can also see which products are coming in, and then we can also use again the data of products that are coming in for health benefits and for so. Yes, you can really focus on the fences and the perimeter, but that's we do classically for 100 years. So now we can also use technology. These are the technological revolution. We can really use technology as a complementary measure. And yes, it is costly, really costly. I cannot, how would I say it? I will be honest about it. Technology, everybody knows that technology is costly, but we had the advantage of the European Union that really financed and stimulated projects like this to have a trial and error, to have an experience. So yeah, this is also why we are here. Initiatives like EuroPris, organizations like EUDA, financed projects by the European Union, that gives a stimulation also for research and development for the industry and for us as a prison administration. So we are lucky in terms of costs.
Thank you. So I think what you're saying here is that the technology, the different technologies need to complement each other, but also that, and again, in terms of data, collecting data, I think when you describe this mobile technology, where you can also actually verify the holes in your regular security system. So you can also track where drugs are appearing in your prison, which also helps improving the physical, let's say, obstacles that you try to arrange for smuggling or trafficking. So
and even a step further, really intelligence gathering of intelligence. And that is not possible with fences, with perimeter measures. So it is more than just technology indeed. Yeah.
Thank you. We have another, let's say, it's quite specific question, and that was from Phil Shakespeare. He asked about your library that you're building in terms of new substances. And his question is how fast you can include these new substances into your library, and what are the steps?
Yeah, good question. It depends on the type of products. For example, it can be several weeks when the product that we propose is not yet under legislation in the United States. Why in the United States? Because the device is manufactured in the United States. So to upgrade the library, to include a product in the library, the supplier needs the product, needs a real product. When the new product is not yet under legislation, it is really simple for the industry to order it online, and then they can include it in a time gap of several weeks into the library. It is more complicated when it's already under legislation. Then it is more complicated. Then it can take 2, maybe 3 months. But maybe, so this is an answer to your question, but maybe something to complement is also sometimes, because we have a library of 160 products, sometimes we have to choose when there is an interference between 2 products. So chemically wise, every product has a formula. And when 2 products are more likely similar, then we have to make decisions. Which products are we going to include and which products are we going to exclude? Because sometimes there's interference with 2 products. But that is really in-house decision. That is really making a decision of which trends, which products is now on the surface in terms of which product is now emerging in our prisons. But timeline-wise, when it's not under legislation yet, several weeks. If yes, 2, sometimes 3 months.
Thank you so much. So we have several questions regarding contacting you after this event to maybe catch up on further partnerships. And one repeated question is if this collaboration will, say, grow in the future, or if there are a limited amount of countries involved. So maybe if you quickly can respond to that, and of course we can share your information afterwards.
No, there's no limited amount of countries, also not continentally wise. So we do not differentiate. It is really about sharing knowledge and sharing experience. So no, there is no filter on amount of countries or where they are situated in the world.
Okay, so if we're not sharing the specific presentation that you made today, we can at least share your contact email maybe for further discussions. So thank you so much again, Sarah. I will open up for the panel now, and we have two distinguished experts with us today, and I will start asking the fairly challenging question to both of you, starting with Thomas and then Angel. What are the most significant challenges in your service in preventing drug trafficking today? So Thomas, please. You're still muted. Let's see.
Unmute.
Yeah.
Can you hear me now?
Yes.
Good, good. Thank you very much, and I apologize for these microphone issues. Well, yeah, in our agency in Finland, which I come from, you can sort of like cut this main problem into two. The biggest at the moment is overcrowding, which, of course, of all we know, comes with an sort of like all kind of other problems within it. And the other thing is, as Sarah really greatly acknowledged, and also in the first presentation, it was also mentioned, these new substances. We do have a sort of for example, we do have a quite big number of detection dogs, for example, but we are always running late when it comes to these new substances, for example, because it is sort of like a race and we are always behind. That's a big problem. And the other big problem is when it comes to the users, with polydrug use, and use of these kind of new substances, users and the health consequences, for example, they are not known. They are hard to predict, and the users are also very unstable in many ways, both in physical and mental health. So it comes with these new substances, in addition to sort of like overcrowded prisons, are sort of like they come with they sort of like combined with very sort of like hard, very evil question to answer with limited resources at the moment. I would start with that.
Thank you, Thomas. It really illustrates the challenges of your the Finnish service at the moment. Thank you. Please, Angel, can you elaborate on the situation in Spain?
Yeah, sure. I mean, as Sarah and Linda have been talking about, there is several ways to introduce drugs inside the prison. I think we have to focus on three main ways to introduce the drug. One, the drones, of course, it's a huge problem because the technology of the drone is constantly improving, and the anti-drone system is not still properly adequate in some countries. In our country, for example, we have two prisons in North Africa, and the drones are coming from Morocco, which are different specifications for the drones. So it's quite difficult to detect the drones. The second way, and very important way, is the inmates are introducing drugs inside the prison. It's the communication with relatives. Or those who are coming back from the leaves, they are taking their drugs inside the body, and we do not have this kind of devices to detect inside the body still. We are working, as Sarah said, in drug detection, but it's drug detection, object detection, if you prefer, on the body, not inside the body. And most of the drug traffic, as everybody working in prisons knows, is people introducing drugs inside their body. And the final issue, another issue is, of course, to introduce a drug through the packages or mail. When we have been working in this project with Sarah, we find out that some of the devices can detect drugs inside the mails, but it's a very small quantity of sample you have to go through the scanner. I mean, if you are working in a big prison, you know that the conventional male are very a huge number. We can talk about like 400 or 500 males going into the prison. So we cannot go take this male and go through this machine. So right now, this is our main issue. Our main problems is the drones, the family of the inmates introducing drugs, and the same inmates when they are coming back from leaves, and the packages or the conventional males. These are our main issues inside.
Thank you, Angel. So it seems like there is sort of a phenomenon that keeps repeating over Europe, and is that when you set up a measure, let's say the prisoners find another way to solve the supply. So we have a question from Ireland where they introduced X-ray scanners, and now the problem has turned into prescribed medication being sold around the prisons. So have you seen this in your prisons as well? And I also reach out to Linda and Sarah for this question. But first, Thomas, if you want to start.
Yeah, when it comes to this described medication, it's also a matter in Finland. As shown in this one of these presentations, we are buprenorphine nation in Finland. I believe that we do have a most like users of buprenorphine, sort of like opioids, medically based opioids in the whole world maybe. And I would say that's our prime drug in any way. So it's basically it's kind of hard. It's kind of hard substance because basically it is a medicine, but in the same time it's used in the wrong way. It's a drug, and also people are using it as described by the doctor's description, also as a drug in illegal use. So it's very hard, and it doesn't smell much. It's sort of like an industrial made very sort of like an quality. It's very good drug in many ways if you look at it in eyes of users. So yeah, it's a problem in Finland also. We used to also have that sort of like a scanning project going on, and I don't know if we were not so sort of like pleased of its outcomes, and I do believe that we do not have these full body scanners. We do not use them at the moment. There was certain sort of like limitations when it comes to jurisdiction and when it comes to the sort of like an effectiveness and so on, and they were very costly. So I believe that that was sort of like a pilot, and we didn't proceed after the pilot in Finland. Yeah.
Thank you. Angel, how is the situation with the prescribed medication in Spain?
Yeah. Normally, the prescribed medication, certain medication is under distribution, but under the control of the staff. So they are not going directly to the inmates, but they are taking this medication before the staff in order to avoid any kind of smuggling. And coming back to the X-ray, I would like to say that we have some fences, legal fences, to use this kind of devices. We would like to know how our colleagues from Ireland or from Netherlands, who are now buying some kind of device, X-ray device, are working with. Because on the other side, they are using that kind of device with the inmates. So it means that the drug is already inside the prison. And we want to discuss with them and to debate with them if it's possible to use this kind of device before the entry of the drug. I mean, in the family, in the relatives or the familiars of the inmates. So this is, I mean, in our country, the X-ray is still not working. We don't have this kind of X-ray device in our prison. I mean, that we have for the medical use, but we don't have for security use. We have to make this difference.
Okay. Thank you, Angel. In terms of prescribed medication, Linda, you were mentioning and also showing this map of, for example, opioid agonist treatment, and Thomas mentioned this as well, and I have the experience from Sweden that I was also frequently used inside prisons. So what is your view on this? And there has been certain developments in this field, I suppose, the last years.
So the first thing is that what we collect, the data we are collecting, that are based on survey. So not all the country have survey in prison, and not all the country collect the same data. So I was just looking, for instance, at the misuse. So we collect data, for instance, we have a model questionnaire where we indicate to provide data on misuse of hypnotic and sedative, which are mainly benzodiazepine, methadone, and buprenorphine. And what I was looking now, so there are 7 countries reporting misuse of hypnotic and sedative with quite high percentages, but varied, like between 20 and 65%. And also in the other case, there are countries reporting misuse of methadone and misuse of buprenorphine. 2 countries only reporting this data. With among the people that were interviewed, there were like between 20 and 50% reporting misuse of methadone, and between 30 and 62% reporting misuse of buprenorphine. So it is an issue. I think one of the big issues is the benzodiazepine, of course, because it's also related to the like a kind of self-medication for mental health issue, as Thomas was referring. I don't know. I don't think there is again one answer in terms of responses of intervention, but for sure, if you cover more with the opioid agonist treatment, and now there is also this long-acting medication that you can provide, like with one injection you cover for 1 month for opioid substitution treatment, that may be more safe also for the misuse, the possibility of misuse. I know that there are some studies on this, and also it leaves more time for psychotherapy, etc. But of course, in the countries where they collect the data, they found misuse of medications. So.
I suppose that also the general sort of response to increased mental health issues is also partly medication. So that we will also see in the prisons. It's a reflective society, yeah.
Also of the scarcity of, I think, health staff in prison, or psychologists, psychiatrists in prison. So of course there are limitations. So if they cannot provide psychotherapy, they have to provide at least something. So with pharmacological treatment, maybe instead of combine, as the evidence show that is more effective, they just provide the pharmacological treatment, and it's more subject to misuse.
Thanks, Linda. Sarah, in your project, have you also focused on prescribed substances and the identification of those?
Yes, we didn't differentiate. So also the device can detect painkillers, for example, benzodiazepines. In the data that we have collected now, we saw the use of sufentanil, so that is an anesthetic. We also saw the use of xylazine, what is a non-opioid tranquilizer. So it really confirms what we were already observing in the past years from data from the medical service, for example, and also from seizures that we have done in prison, that we also found prescribed medication, but that's another prisoner is taking it. So it's really an illegal market of prescribed medication. Yes.
Okay, so again, what you're describing is also using the tool as an intelligence tool rather than, let's say, a repressive tool or a strictly security tool. Thank you. We will sort of have already started touching upon the topic of rehabilitation and how it sort of relates to the health issues in prison. So there is question to more concretely describe from Josif Xatlos Dima, whether you can give examples of when technology and rehabilitation has complemented each other in a good way for a better outcome. If you have any examples of this, that will be very valuable.
I can take that.
Yes, sure, Sarah. Please go ahead.
For example, very concrete, when we collaborate with the medical service. So for example, in one prison, we use the device and we see, okay, these and these products are used, are emerging in this prison. Then we alert the medical staff. And as we know, there are also users in prison that are hidden users. And that is also a way forward for medical staff to have a consultation with certain prisoners to reach them out by the medical staff, and not by the prison staff, but by the medical staff, to reach out to really unreveal hidden users. And in that way, we can also reduce the harm of those hidden users, because everybody who is working in prison, most of the users we know. Most of the users are known by the prison staff, but there's also a proportion of users, the hidden users, we call it the hidden users. And by that way, we can, but again, through medical staff, not by surveillance staff, by medical staff, we can go into dialogue by talking about these issues and raise awareness, but also create motivation to talk about their consumption, to go to counseling. So this is really a step up to orientate, to do a referral to drug treatment, for example. But this only works under the following condition, and that is when you also engage the medical staff and the medical service. If not, it is then you intervene in the dialogue or the conflict between security and health, and that is something you don't want to have. But the medical staff and the medical service, we are really grateful that they want to take this up, and that they can have the consultation and have the referral to drug treatment measures that are in place in prison. Yeah, that is one example.
Thank you for a very concrete and clear example. Anyone else in the panel who wants to contribute to this request?
Yeah. May I? Yeah. As you have said at the beginning of the webinar, the issue of the drug inside the prison should be addressed from three pillars: security, healthcare, and rehabilitation. And what we have in Spain, it's a kind of board in which we point together all the members of these the different areas, and they talk together on how to address this issue from time to time. So I think they should have, I think that it's one meeting per month, and they talk about the issue of the drug, the new trends, the new methodology to implement rehabilitation, or what kind of drugs, new drugs have been identified inside the prison. So this is a kind of collaborative work inside our prisons.
So that's more on the organizational side, to sort of organize yourself to cover those three areas and not only one of them. Interesting. Linda, you want to come in? You have the European perspective.
Yeah, of course, all the countries are different. Then I think there are like intervention that you can do at the level, more at political level. So there is the WHO, for instance, provide this recommendation of moving the health services under the Ministry of Health. I think there are still not evaluation, that there were two evaluations, probably one from Finland. I don't know what was the result of it, because I think it's not so straightforward, this issue, but this at least to ensure the independence of the health staff inside prison. I agree totally with both Angel and Sarah, that this coordination of the different stakeholders is really important. And I would add probably also the peer involvement. So there are countries where peers are involved, so peer organization, and then it's facilitate the way this information is communicated, is transmitted from one to the other. I think, of course, there are some interventions where there is evidence that they work, and then they should be implemented. There is no reason for not implementing them. Like again, some harm reduction services, they are working well. In Luxembourg is a small example. They have like a really comprehensive packages of harm reduction, and these work quite well, including opioid agonist treatment, needle and syringe program, but even the safe tattoo program. I think it was stopped now recently, but that can be something that I think there is no reasons except from ethical reasons. So several articles show that there are no risk on this. That's what I would say. But of course, there is no only one example which is the best example. This, at least I don't know.
Thank you. So we have another question from Virva Raitio, a colleague in Finland, and she's asking about, from a more comparative perspective, which countries in Europe have, let's say, alternative sanction drug treatment outside prison and maybe more in an institution. And I know from the Swedish context where I come from that there is something called contract care, and it's frequently used, and that can be replacing up to 2 years in prison if you have a well-designed, robust treatment plan. But are there other examples of these kind of alternatives? Because gathering a lot of people with drug addiction in the prison is, of course, going to attract a lot of problems. So is there other ways of keeping this more of a health issue, trying to solve it outside prison?
I don't know if it's probably the other expert can provide their. I don't have an overview of the alternatives to incarceration. We produced a report some years ago on this because my focus is inside prison. But of course, I know in Italy, for instance, there are alternatives to incarceration if you are drug addicts. So if you have certification of drug addiction, or in Portugal, they have, as you know, this decriminalization policy. So the person that are catch to be using drugs or a problem, then they have to go to in front of the commission. That is again a coordinated commission where police, as professional social care, decide on a program. Then, of course, there are in several countries also programs specific, for instance, for mother, where they are put in a specific institution. I think one issue it's important is not only the law, the specific legislation, but how the legislation is implemented, how it is put in practice. In the case of people who using drugs, because as I say at the beginning, it's not just the drug law offenses the problem, but the drug use also before, which then of course it will take inside the drug. So I would say this, but and I think in the Scandinavian country probably where there is a very low incarceration rate, they have more attention to this aspect. And the last thing I would like to add is that another important issue is the linkage to care. So this when you implement interventions that the health services inside prisons should be linked, should be related to those outside, both when the people enter prison and when they leave. So this connection, it's really important for continuation of the treatment, but also for preventing relapse, reoffending beside the health consequences. So also for the community, I think it's important.
Thank you. I'm also thinking that I mean, we see these treatment programs which include also pharmacological treatment. Do you in the panel know of any examples where you sort of concentrated these prisoners or patients, if you call them that, into one prison or one wing to sort of isolate the issue of trafficking of these prescribed drugs?
Yeah, at least in Finland. Closed prisons. I believe that every closed prison in Finland will have this sort of like an anti-drug, sort of like an drug-free unit or cell block or whatever you call it in a different, like assets. And they do have a sort of like a continuously testing all the times based on your sort of like on the location, based that the inmate is located to that sort of like a specific ward or specific sort of like a block. They can be tested all the times, and then they try to create that sort of like an anti-drug or sort of like an anti-use environment there. And more often they try to make that sort of like a path of sort of like a soberness continue. That's make that sort of continuum from a closed prison to open prison, which are also drug-free units in Finland, and also from the day when the prisoner is released, they might have a sort of like an agreement with that sort of like an private or sort of like a public sort of institution. There they can sort of like continue their sort of like a treatment before sort of like after the sentence. So they try to make sort of like this kind of paths into sort of like a soberness. That is very sort of like our goal as well. Yeah.
If I may add, there are in our data we saw that there were 21 countries, at least in 2022, that had therapeutic communities inside prison. But we found only 2 countries providing also pharmacological or substitution treatment in this therapeutic community, which is not the same thing as the drug-free wings. So where there is a kind of agreement between the prisoner and the prison administration. In the therapeutic community, they provide some also counseling, some activities like, and is like either a specific wing or area of the prison, as Thomas was saying. But I've heard there is quite some interest from some countries to see the experience of these therapeutic communities in prison.
Yeah, if I may, Gustav.
Yes.
Yes, just to say that of course we have that kind of therapeutic units in our country, and but we have to say that the treatment is on a voluntary base. So you are not it's on you if you want to go to this kind of unit or not. But the attention in our country is medical care, of course, with medication, whatever. We also have psychological treatment, psychological support, and also we have this unit, therapeutic unit. And in all those kind of treatment or those kind of way to address the drug issues, we also have link with outside the prison. So the continuity of the treatment or the intervention could also be go further once you serve your sentence.
Thanks,
Maybe
Angel.
I say something, Gustav. Yes, just to underline that also in Belgium, we have drug-free units or drug-free wings, but we really try to evolve to drug treatment units because in the beginning, drug-free wings are really focused on security, controlling, drug testing, are you using or not using, but it's not effective. We know from research that it's not effective. It is effective if you combine it with a treatment program. So that is really key. If you want to install drug-free initiatives, that you made a combination, security measures, drug testing, and a treatment program. And just to underline also the focus of the webinar, And also the linkage to the outside world and outside treatment, like also Linda and Angel highlighted. The problem in Belgium, and not only in Belgium, if I can say, is that there's a shortage of places in the outside world concerning treatments for civilians, waiting lists for civilians. If you put on the extra pressure of prisoners, ex-prisoners who want to come into the treatment system outside, yeah, there's really a shortage. There is already a shortage for civilians. Take into account also a lot of prisoners who want to go into treatment after their prison sentence or as an alternative. There's a really big pressure on the treatment centers in the outside world. And that also intervenes with the fact of Linda, who was saying also a Ministry of Health, of Ministry of Justice, who is accountable and responsible in terms of investment in treatment in general for prisoners, but for civilians. But that's really worsens the problem. Yeah.
Thanks, Sarah. That's a very important. I think that the financial incentive, so to say, is very important. A really fine thing with the contract care in Sweden, which I was working with for several years in the probation service, is that actually the penitentiary system is paying for that treatment place. So the cost is not on the community or the municipality, but actually it's related to their punishment, so to say. So it's paid by the prison probation service, and I think that's might be an efficient model when you sort of want to increase capacity in the community, that other stakeholders also cover those costs. So because a place in a prison is not cheap either. So that sort of evens out, I think. We will soon wrap up. I will end up with one very concrete and technical question, since this was one of the topics of the webinar, and that is the question of using wastewater for similar analysis as you are doing, Sarah, in your project. So if you have any comments on that, knowledge about countries using wastewater. I've heard about it, but I'm not exactly sure.
I know in France they've used, but for epidemiological purposes. So and then it has the limitation that has the wastewater analysis. So it's, looking at the quantity of the residuals that you have and not, so you don't have an idea of the number of individuals. I'm not an expert on wastewater analysis, but this is what I know. And the other issue in prison is that you cannot distinguish who he is consuming, because it's from the sewage of the whole prison. So it can be staff, can be people in prison, it can be anyway. But what I know, it was this example, but maybe Sarah has more information.
Yes, we took it into account in the project. So we examined it, the possibility, and effectively, like Linda said, we cannot make the link with who is using. That is one thing. But if you are interested only in mapping, you could say, I'm not interested in who is using. But the cost of a continuously monitoring of wastewater is really huge. There are examples of wastewater analysis, but it was really a momentum, a certain time line doing by researchers. But if you really want to have a continuously monitoring day by day, it is too costly. Yeah.
Thomas, Angel, any comments on wastewater? Did you try that in your jurisdiction?
Funny that you mentioned that, because that was news in Finland like a week ago, that the Ministry of Public Health and made that sort of like an I believe that it was nationwide, sort of like a wastewater examination, and the winner in a bad way was a small southwestern town within a quite big prison. It was sort of like the number compared to other was huge. So at least we now know that most probably in that prison they are using lots of buprenorphine, but well, we knew it already, but now we got a confirmation. So yeah, we used to use those own sort of like an ordered wastewater examinations like 10 years or some ago, but I believe that they were too costly, as Sarah mentioned, and you don't get sort of like a real information otherwise, but then drugs are used in that prison, and that's it.
Okay.
Yeah.
Thank you. Angel, did you try to explain?
We did not try. We just tried to participate in one of the projects from the EU project in order to implement this solution, but we did not get the point.
Okay, thank you.
Welcome.
So the time has come to wrap up. I mean, we could continue for another hour, but this was very, very interesting. And I think the duality of rehabilitation and security is so important to investigate and explore further. So thanks again to Linda, Sarah, Thomas and Angel for participating and presenting. The PowerPoint of Linda we can share afterwards, and also hopefully the contact information to the panelists. There will also be a video posted on our website in due time for sharing with your colleagues. And I would also like to encourage you to follow EuroPris on LinkedIn, and you can also subscribe for our newsletter on our website. If you are a EuroPris member, you can also create an account on our website to get access to more services.